How do we address exercise intolerance after a concussion? Can exercise be medicine after a concussion? A concussion is a traumatic brain injury having widespread cognitive, emotional, and physical effects. One effect of a concussion is exercise intolerance, which is the inability to exercise to the level predicted for one's age and fitness. Typically, concussed patients stop exercise because of a symptom exacerbation. The concept of rest is best was previously supported by evidence of a vulnerable period early after a concussion, during which the brain is susceptible to repeat injury, worsening of symptoms with cognitive or physical stress, or prolonged recovery with excessive activity soon after a concussion. However, recent evidence shows that moderate levels of physical activity within the first week after injury reduces the incidence of persistent post-concussive symptoms compared to those who don't participate in any structured physical activity. The principle of exercise as medicine is that the healthcare system should consider exercise as a form of medication or treatment that should be prescribed to patients. However, as with medication, it is essential that exercise be prescribed based on a dosage that suits the characteristics and needs of the concussed individual. The physiology of a concussion and its effect on exercise. The metabolic and physiological changes of a concussion result in altered function of the autonomic nervous system and control of cerebral blood flow. The primary autonomic nervous system control center in the brainstem may be damaged in concussion, particularly if there was a rotational force applied to the upper cervical spine. Altered autonomic regulation after a concussion is believed to be due to changes in the autonomic centers of the brain and/or an uncoupling of the connections between the central autonomic nervous system, the arterial baroreceptors, and the heart. Of relevance to concussion, the autonomic nervous system controls the cerebral blood flow response to exercise. The following occurs in those with persistent post-concussive symptoms. They have abnormally low sensitivity to the arterial CO2 tension, which causes a relative hypoventilation during exercise. It raises arterial CO2 tension levels out of proportion to exercise intensity. Cerebral blood flow is directly proportional to arterial CO2 tension. Hence, elevated CO2 tension raises cerebral blood flow disproportionately to exercise intensity. It contributes to symptoms of headache and dizziness that significantly reduces exercise tolerance. Subthreshold aerobic exercise treatment increases CO2 sensitivity to normal, which normalizes arterial CO2 tension, exercise ventilation, cerebral blood flow, and exercise tolerance. CO2 sensors are located in the brainstem, near the autonomic control centers for cardiopulmonary function. Thus, subthreshold aerobic exercise improves the central physiology of the concussed brain and reduces symptoms in those with persistent post-concussive symptoms. The benefits of aerobic exercise after concussion. Motivation for exercise after brain injury is important. If you're forced to exercise after concussion, the corticotrophic axis can be stimulated, increasing stress hormone levels and halting the release of brain-derived neurotrophic factors. Whereas if exercise is voluntary, BDNF is increased and exercise can be beneficial to recovery. There are extensive data to suggest that exercise, specifically aerobic exercise, attenuates cognitive impairment and reduces dementia risk in humans. Changes in the brain can be seen as early as 5 to 6 weeks after starting an aerobic training program. Proposed mechanisms include promoting neuroplasticity by increasing BDNF for neuron growth and repair, increasing proliferation of neuronal stem cells, reducing neuronal degeneration and apoptotic cell death around the damaged area, increasing Purkinje neurons and suppress formation of reactive astrocytes, increasing hippocampal volume to improve spatial memory, mitigating vascular disease risk, and improving cognitive performance by reducing DNA fragmentation in the hippocampus. The Buffalo Concussion Treadmill Test, Assessment for Exercise Intolerance. The Buffalo Concussion Treadmill Test is the gold standard for assessment of exercise intolerance. It is a systematic and reliable method to determine the symptom exacerbation exercise threshold in concussed patients. The results are used to prescribe an individualized, progressive, sub-symptom threshold aerobic exercise program that safely improves symptoms and helps restore function. The patient walks on a level treadmill at a certain speed. The incline is gradually increased, and then the speed can be increased if the patient passes a certain point of the test. Parameters including heart rate, symptom severity, and the board rating of perceived exertion are recorded until symptom exacerbation or voluntary exhaustion occurs. Since the treadmill is not appropriate for all patients, there is also the Buffalo Concussion Bike Test. They can both be repeated every 2 to 3 weeks to establish a new symptom-limited threshold heart rate for exercise. Exercise testing on the treadmill should only be considered for those patients without orthopedic or vestibular problems that increase the risk of falling, and general exercise testing should only be considered in those patients who are at low risk for cardiac disease. Prescription of an aerobic exercise program based on the Buffalo Concussion Treadmill Test. After establishing the submaximal symptom exacerbation threshold, the patient is prescribed exercise on either a stationary cycle or treadmill for 20 minutes a day at an intensity of 80 to 90% of the threshold heart rate that was achieved on the test, once a day for 6 to 7 days per week using a heart rate monitor. These parameters are based on the amount of weekly exercise needed to achieve a cardiovascular training effect and modify cardiac autonomic function. A subthreshold heart rate can also be determined if the patient is unable to undergo a Buffalo Concussion Treadmill test by starting at 50% of their maximum heart rate. The most important guide is the patient's symptoms and to ensure that they stay below their symptom exacerbation threshold. Using a heart rate monitor is helpful, as after a brain injury, there is poor heart rate response to physical activity, and symptoms often do not correlate with the expected increase in heart rate. Thus, objective monitoring of heart rate using a heart rate monitor during physical activity is beneficial to promote recovery and safe participation in physical activity. The rate of improvement and progression in exercise intensity varies among concussed individuals. The purpose is to provide specific goals to achieve without focusing on speed to recovery. Physiological recovery is defined as the ability to exercise to voluntary exhaustion at greater than 80% of age-predicted maximum heart rate for 20 minutes several days in a row without symptom exacerbation. Until recently, recommendations for concussion have been rest and avoidance of activity. However, prolonged rest can exacerbate symptoms and delay recovery, as physical deconditioning can impair autonomic control of cerebral blood flow. Individualized subthreshold exercise treatment is safe, non-pharmacological, and well accepted. Improvements on the Buffalo Concussion Treadmill Test. Performance on the Buffalo Concussion Treadmill Test, or the bike test, indicates whether exercise intolerance after concussion is associated with abnormal autonomic function, while restoration of exercise tolerance indicates normalization of these fundamental physiological mechanisms. The ability to exercise to exhaustion on a treadmill test without symptom exacerbation is one definition of physiological recovery from concussion, which translates to recovery and readiness to return to activity. Restoration of aerobic exercise tolerance, however, may not coincide with recovery of full neurological function after concussion. Data obtained from the test can help clinicians make a return to activity decision more objective and physiologically based, but there are other factors that are equally important to determine readiness to return to activity. Use of the Buffalo Concussion Treadmill Test to diagnose other causes of persistent post-concussive symptoms. The Buffalo Concussion Treadmill Test is used to determine whether persistent post-concussive symptom patients have recovered from exercise intolerance due to autonomic and physiological disturbance. However, as there is more than one cause of it, the patient's performance and symptom pattern during the test combined with a comprehensive physical examination, can help with a differential diagnosis. A patient with persistent post-concussive symptoms who exercise to exhaustion without exacerbation of headache or other symptoms no longer have physiological concussion. Rather, they have a different cause or causes of their symptoms. Most commonly, other potential causes can include a cervical injury, vestibular ocular dysfunction, post-traumatic headache syndrome, or a combination. A careful physical examination of the cervical spine and a neurological examination focusing on the vestibular system and oculomotor responses can help identify sources of symptoms such as dizziness, headache, trouble concentrating, and blurred vision. Exercise itself can induce symptoms of fatigue, headache, and dizziness near voluntary exhaustion, whereas concussed patients are limited by symptoms early. The key differentiating point is that those with cervicogenic headache or cervicogenic dizziness are able to exercise near to exhaustion despite symptoms, whereas concussed patients stop early at a submaximal level because of significant symptom exacerbation. Some patients with severe vestibular dysfunction may also stop exercise tests early, but it's very clear that the vestibular dysfunction is the cause. If the patient's persistent post-concussive symptoms is no longer due to a physiological concussion, they may benefit from aerobic therapy combined with additional targeted interventions such as manual therapy, vestibular rehabilitation, and rehabilitation exercises, tailored to the causes of other specific post-traumatic issues. Thus, the Buffalo Concussion Treadmill test, combined with a complete physical examination, can help the practitioner narrow the differential diagnosis of persistent post-concussive symptoms and direct therapy to the specific cause, enhancing the return to activity process. So make sure that the Buffalo Concussion Treadmill test is a component of your multimodal post-concussion assessment.